So we shall be talking about the effect of hypoglycemias on relationships. So you may have actually heard these words, hypoglycemia and hyperglycemia. So in diabetes, because there is a problem with the metabolism or the utilization of the glucose or the sugar that we have consumed, so patients may experience hyperglycemia, which means higher sugar levels, or hypoglycemia, which means low sugar levels. Now the fear of hypoglycemias may be there in patients who have diabetes and their partners or immediate caregivers. In hypoglycemia, patients have low sugars. Patients may have symptoms like ghabrahat, they may be sweating. Sometimes patients are able to recognize these symptoms. They may have mood swings, they may have mood changes. So the attendants may be able to actually recognize things. But if this hypoglycemia continues for a longer duration, or it is unattended, then it can become severe. It can have neurological consequences. Patients may have severe, they may develop seizures, they may develop strokes, there may be a cardiac issue associated with it, and rarely it may actually lead to the death of the patient. So therefore, there is always a fear of hypoglycemia in the minds of the patient and the immediate caregivers. So we need to understand that why this hypoglycemia happens. Hypoglycemia commonly occurs because patients are either taking higher doses of insulin or their oral drugs than recommended or required. There may be that patients have skipped their meals. They may be unusual, unaccustomed exercise that they may have done. But it is important to recognize and to react to a diabetic partner or diabetic patient's hypoglycemia. It is important to actually have a balanced mindset and to react very calmly, because sometimes these hypoglycemias can be very frustrating in a relationship. It may cause insecurity. So it is important to manage them very calmly, deal with them calmly, not add to the stress of the patient. So the fear of hypoglycemia may actually exist in the minds of the patient or in the minds of the immediate caregivers, in the mind of the family, in the mind of the spouse, and sometimes in the minds of the colleagues. It is important to give them a patient hearing. It is important not to be stubborn, because they would want a good glycemic control without you having a hypoglycemia. It is important to have an open discussion. It is important for the patient and the spouse to discuss openly about the fear of hypoglycemia, why that hypoglycemia is precipitated. It is a good idea to actually go and see your physician, your diabetologist, to discuss about the hypoglycemia, to educate about yourself about the effects of hypoglycemia, and be prepared for the emergencies that may be associated. So while talking about hypoglycemia, it is important to understand that when a patient is experiencing hypoglycemia, the patient may actually have mood swings. The patients may sound silly, they may be unusually happy, they may appear paranoid, they may get very agitated and angry, but they may sometimes be even very violent. But the change in character of their behavior needs to be understood, especially by the immediate family and by the partner. We need to understand that this could be hypoglycemia. During an episode of hypoglycemia, the patient may actually be very similar to somebody who is drunk. So sometimes, after the hypoglycemia is controlled, the situation may revert back to normal, but the partner may not understand your reaction as a caregiver. So you may sometimes actually need to apologize for your actions which were essential during the episode of hypoglycemia. It is important to reassure yourself and the spouse who has had a hypoglycemic episode. Ultimately, it is important as a team to reassure yourself to understand why the hypoglycemia happened and to understand how we can prevent a similar episode. We also, as an immediate caregiver, need to identify the hypoglycemic features that the spouse, the partner or the immediate family member may be experiencing, so that it can be identified and aborted as early as possible the next time it happens.